Hey, everybody, welcome back to Casual Conversations. I'm your host, John Malanca with the Association of Cannabinoid Specialists. We have Dr. Jordan Tishler as well as Dr. Adam Abodeely. And we're missing a couple others, but maybe they'll pop in. But it's always great to see you. Here's a topic that comes up, and I'm certain you both get asked about this quite a bit. It's about cannabis, vets, and PTS. This is something that comes up, and I'll touch two things. One, cannabis is still illegal at the federal level. The VA hospitals do not allow the vets to use it on premise. But the VA hospital also is doing research on it, which is the same thing like cannabis is a neuroprotector with no medical value, schedule 1 versus no schedule 1. And so, but I do know there was a 2023 study that I showed that vets, I think it was like, let me see if I can find it here really quick here. It was a total of 510 veterans of the U.S. military service participated in the survey. A majority of participants, which was 91%, reported that medicinal cannabis treatment helped them to experience a greater quality of life, fewer psychological symptoms, that was 80%, and fewer physical symptoms altogether, which was 73%. And as well as many more reported using less alcohol, 46%, fewer medications, 45%, as well as less tobacco, 24%, as well as fewer opioids at 21%, with the result of medicinal cannabis. But at the same time, there is a sad number that 22 vets take their lives daily. And it's a tough number to talk about, but we're starting our podcast off with this. And if it would either of you like to finish up the rest of my thought process on that, or my opening statement.
Sure. Listen, I'm glad to begin here and share with my experiences on PTSD and cannabis use for PTSD. You know, PTSD is a condition that I find very similar to cannabis's use for several other conditions we use, particularly what I am accustomed to using cannabis for in my practice, which is for cancer and GI issues. And we know that with cancer and GI issues, what are we treating? Well, it depends upon what symptom we're treating. If it's cancer, are we treating pain? Are we treating nausea? If it's GI, are we trying to affect diarrheal conditions? Are we trying to treat gastroparesis, which is a whole nother topic of, but PTSD is something that is also very similar to that. And one of the very important aspects is trying to figure out what does PTS or PTSD mean for that patient? What do they truly suffer from? Because we know it's a syndrome, if you will, of a variety of different potential problems, ranging from sleep disorders to pain, to anxiety, to depression. And the decision to treat those patients with medical cannabis is going to be largely dependent upon what symptoms you're trying to treat. And and I have treated a few patients with PTSD, and the biggest challenge for me personally is trying to determine the anxiety component of it. And anxiety and THC can be a challenge, mixing those two. And so it's always challenging for me to figure out, and especially when patients come in and they say they're already using it. Well, I've got to be mindful then of, well, what are they using? Do I believe they're using? Do I believe they're using as much or as little THC as they claim to be using? So that is one thing that, I find challenging in considering and developing an optimal, plan or recommendation for these types of patients is anxiety, first and foremost. But second, is making sure that they don't have they're also not prone to any underlying psychiatric predisposition. So is it safe for me to assume that somebody with an underlying predisposition to a mental condition might be more predisposed to PTSD, which might also make them more susceptible to psychosis or potential problems that could arise in any sort of cannabis-induced psychosis. So for me, it's very, and I think true for anybody treating PTSD patients with cannabis, is really trying to figure out the symptoms. And And largely what I've found is that most of the patients say it's for depression and anxiety. They all, of course, all have majority of them all have um, underlying or insomnia, problems with sleeping as well, but they're not coming there specific. The person with referrals for PTSD are not coming just for insomnia. Otherwise, they'd be coming referred for insomnia, which is a different animal to address than PTSD. Um, so in those cases, it's just really a matter of putting it in context, particularly for me as a surgeon who is not medically maybe as astute as some of my medical colleagues, is really trying to make sure that I don't cause any harm in these patients by prescribing THC products or THC products too high in the beginning. And that's probably one of the biggest take home messages that I would say.
You mentioned all these other different symptoms as well. Another one that a lot of vets go in there for, and maybe it's a domino effect with everything else, is pain. Being given pharmaceuticals, which again wrecks the gut. When the gut's off, everything else is off. And I want to be careful here, but highlighting and really making the post-traumatic stress um, um, even more, I guess, aware that in their life than they would if everything else was in balance. And so you mentioned, anxiety, no one's or insomnia. They're not coming in for that. But Jordan, are you seeing veterans coming in for other issues? I mean, that I guess with the double effect with, of course, the post-traumatic stress and pain and being, I don't say addicted to opiates, but dependent on opiates. Because the reason I say that, I have a cousin who's, you know, uh, fought in one of the wars, and he came back, and alcohol, post-traumatic stress, as well as opioids, were part of his life, and so is controlling as much as he can, but it's a long, and hopefully it's not a lifetime of having to go through this, and it has been a few years, almost 2 decades now.
Yeah. I think that the point that Adam made, which was really spot on, is that individuals have a constellation of symptoms related to this traumatic set of events, and not everybody has all of them, and so anxiety, depression factor in large. But also insomnia and pain, as you mentioned, which isn't really directly related to PTSD, but they are intertwined in a way that it's difficult. I think the point is that these are all facets of the organism,
Yeah.
and when things are awry, that underlying disorder gets expressed in multiple ways. And some people express it through being unable to sleep, and other people express it through having tremendous pain, which may be somatic in origin, but their reaction to it may be more brisk than the next person. And so all of these things factor into any individual. And the thing that makes cannabis or cannabinoids wonderful as a medicine is that it addresses many of these facets sort of all at
Yeah.
once. And so you can have somebody who's in terrible pain and has depression and insomnia, and you can approach all three of these things, which diagnostically might seem as individual items, as really a whole, and put it together in a way that ameliorates all three of those things.
Yeah.
And so in many ways, cannabis or cannabinoids are really ideal in that way, rather than, say, giving somebody a benzo for their anxiety and opioids for their pain, and some other agent for sleep, where now you've got a whole bunch of medications going on, and they're sort of doing their job, but not necessarily in that holistic or necessarily as effective fashion. That being said, I think that there are significant issues with cannabinoids. For example, and this isn't directly related to PTSD, but there was a study that was published yesterday that took a look at people's use of benzodiazepines before and after being prescribed medical cannabis, and this was in Canada. And basically what they found was that even though cannabis had been added to the regimen for their anxiety, their use of benzos did not decrease.
It's funny because there was a study about vets where 18% of their opioids decreased when using cannabis.
Well, that's their opioids, but this is about benzodiazepines.
Okay.
So it's not necessarily the same thing. There's no question. There's some very good studies that have shown much better reduction in opioid use, somewhere between 40 and 80% when cannabis is introduced. But we've never seen that study done for benzos until these guys, and unfortunately, it doesn't look as good as we had hoped. Now, one of the caveats with that study is they didn't do it in a way that they could ask the people before cannabis, was your anxiety under control, right? So it may have been that they were using some benzos and you added cannabis, but when they were using the benzos alone, they weren't getting adequate relief, and now they are with the combination. So you wouldn't necessarily expect the benzos to decrease because they need both, right? But circling back to the PTSD thing, I think we have a really good understanding that patients, meaning in this case veterans, will report that cannabis use helps them with their symptoms. But at the same time, we also have a fairly robust literature that shows that veterans aren't getting the guidance that they need from the medical establishment, and in typical fashion, they get their guidance from their buddies, and that has a tendency to lead them into much higher use, and that can backfire, as Dr. Abodeely was saying, in terms of making their anxiety worse, and you can kind of get into a vicious cycle there. And a lot of the work at Johns Hopkins under Ryan Vandry has really shown that veterans can kind of get themselves into a pickle with this stuff because they're listening to their buddies and they're not getting what they need from their docs, whether it's a VA doc or an outside doc. So, we need to caution the veterans that they need to go find somebody who's going to give them better advice, and also to follow along to make sure the train stays on the track. But they also have to be able to find somebody who's knowledgeable, and that's a lot of what we're doing here at the Association of Cannabinoid Specialists, is trying to make sure that the clinicians that are out there know this stuff so that they can give good advice to the veterans.
I think the veterans, I think as the stigma is dropping, people are more open to talking about this. And I know prior to coming on camera, we were talking that a couple VA groups have reached out. Let's learn a little bit more about this, and just let's see if it's really stands up to what many say. And I know you guys agree with this, that it is not, this plant is not for everyone. And I think the three of us are the first to say that, but I think education is important. And again, I agree with you that, we do this casual conversation podcast for that, to spread the word, just like, as I mentioned before, the pebble in the pond, and getting the ripple effect to reaching doctors, physicians, and the VA hospital, and lawmakers, because it's needed. Veterans, do you work with a lot of veterans, either of you? I know, first off, congratulations, Adam, for being nominated for the Department of Health in New York to be one of the head medical cannabis physicians. So congratulations on that.
Yeah, thanks. I look forward to it. It's a new developed organization in New York State, which is going to help hopefully shape the legislation and safe cannabis use for medical patients. So, and I look forward to the.
And the reason I say that is because I'm certain that you will be running into veterans in this, and I think your voice will go a long way in that state and beyond.
Yeah, no, absolutely. I look forward to it. And again, the vets they can be a complicated group when it comes to treating them and all their different symptoms, and again, unfortunately, a lot of that, as we talked about, with their own personal challenges that they've had incorporating it into their lifestyle or into their wellness or health, regimen, just because of the fact that they're part of that VA system is, may have pushed them down pathways that, we have the opportunity to kind of redirect them,
Good.
and them kind of some cannabis care and coaching and education that is, more in line with, really affecting their conditions in a way that's not going to be causing them harm. Because I do see a lot of the vets that do come in, they're on some pretty high doses of cannabis already, and trying to convince them now that the best path for them might be cutting back and kind of restarting, or kind of look at a different angle is a challenge. And unfortunately, but it's a challenge that we're in, and we can certainly help.
Good.
It's been really interesting in Massachusetts where I work. Obviously, we have progressed from medical legalization to recreational legalization. And I think that the nature of my practice has changed quite a bit over that period of time. It used to be that people would come to me and they would say things like, well, I might have smoked a little back in the 60s, but I haven't touched it since. And so essentially, in terms of treating whatever they had come in for, I was starting with a clean slate. And quite frankly, it's a lot easier therapeutically to start from none and work your way into a regimen that's simple and straightforward and low dose, compared to now where there's this whole recreational market, which is really pushing people to self-medicate. And then I get them and it's like, yes, I've been using weed for a year now and I'm smoking, a couple ounces a month and it isn't helping, or my anxiety is only worse than it ever was. And you're like, well, yeah, I understand what's going on here. You went from 0 to 60 in 2 seconds and you blew right past, the idea that, 5 to 20 milligrams was really the effective range here. And it's much harder sell to somebody who's using a lot than it is to sort of say, let's start with just a little bit and let's see if we can get you where you need to be. So this isn't really the topic of our conversation today, but recreational has absolutely made therapeutic use much more difficult. And I think that that's certainly even more so for the veteran population, where, historically they were getting their guidance from their buddies. And, the VA is behind the 8 ball insofar as they have spent a very long time. And I'll remind you that I spent 15 plus years working for the VA. But they're behind the 8 ball because due to the federal government, and so it's outside of the VA's responsibility in many ways, but due to the nature of the way our government and the VA is set up, they've kind of been sort of going la, 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 la for a very long time. And now, not only do they have to play catch up in terms of learning the material, but they've also kind of besmirched themselves, right? I mean, I think a lot of veterans have this attitude about the VA, which is, oh, they just like to give you pills and they're not going to listen to me and that sort of thing. And I don't think that that's fair overall, but it certainly has been the case for a number, many veterans, or at least they've had that feeling. And I think that this is an opportunity as we're moving forward in the cannabinoid space for the VA to get more involved in the clinical aspect of things, not just the research that you mentioned, John, and to be able to sort of welcome back in some ways some of these veterans who have felt ostracized, and to sort of rebuild some bridges there. And I think we need to get there. We need to welcome that.
I'm reading as we're going here about the treatment, and they said after treatment with cannabis, total sleep scores, subjective quality of sleep, sleep duration significantly improved, and which also in turn brought the PTSD symptoms score down, which is intrusiveness, avoidance, as well as alertness, and it did show improvement. So again, I keep on using the domino effect because I talk about that quite a bit of when you tackle one thing, a lot of times, not all cases, but many times everything else will follow follow suit. And so, that was from the Frontiers in Psychiatry. That's the right word. It's a tongue twister. In a 2023 study showing medical cannabis treatment for treatment-resistant combat PTSD.
That's also an observational study, as I recall, meaning, they were asking a bunch of PTSD folk about their use of cannabis. There wasn't any control group. There wasn't any group that had PTSD and not using cannabis. And there certainly wasn't any prospective randomization, that sort of thing. So, again, these studies are very descriptive and very helpful. They don't give us the bottom line. And, another example that's actually sort of more in Adam's wheelhouse is that if you ask patients with Crohn's disease about quality of life from using cannabis, you'll find that their quality of life is much better, and that's important. But if you actually endoscopically or serologically examine what's going on with their underlying disease, you find that it isn't changed at all. And so there is a bit of a push-pull between what do people feel versus what's sort of more objectively going on. And we as scientists need to kind of answer both questions. We need to know how people are feeling, but we also need to know why, and is it their perception, or are there not, or are these things actually changing? And they're not always the same answer. And sometimes people don't appreciate when we start to try to look at the causality as opposed to how they feel, because they get very focused on how they feel, which is totally understandable, but not scientific.
So all in all, you would say that you would agree that they should have access to it, but a little more science and studies and medical attention should be involved with this to see if there's mental versus pain.
Not just that. I mean, I think you kind of summarized it really nicely. I think that they should have access to it, but they need to have access to it with somebody who knows what they're doing to guide them so that they get, an appropriately formulated regimen with an appropriate dose and frequency of taking the stuff. And also that it's not a one and done. It's not like, oh, go get some gummies and you'll be fine, right? In my clinic every 6 months, but whatever the appropriate interval is for that patient's care, you got to check in with them and make sure that they're getting the benefit, that they haven't jacked up their dose, that they're not developing other problems. I mean, and this isn't any different from any other medicine, right?
Or any other symptom, because less is more and more is not always better, and it's not a one size fits all. And
Yeah.
again, a medical professional, and you've talked about how your practice has changed, and I don't think it's just with the veterans coming into your practice, but I think with laws.
No.
But I mean, even in the Massachusetts, where laws have changed from medical use to recreational use, and same thing in California, you know. Once it became adult use, 21 and over, many physicians went out of business because there was no need for the physician anymore. And that's the part that I truly believe should have stayed in effect. And when that came to ballot 2016, I want to say, I voted no on it for the 21 and over. Not that I don't want everyone to have access who needs access, but I truly believe that a medical professional should be involved. The patients that we're working with, and I think the thing with the two of you, need a little more hand holding. These are many were first time patients. Where do I go? Or I tried it in the 60s and now we're in the 2020s. It's not the same. Do I take more? And so options, but education, and this is what we do here. Any closing words? I know we can continue on here, but any closing words or last statements? Adam, do you have anything to say?
No, other than I'm glad that Jordan touched on the quality of life issue, because that is something that is, comes up over and over. And I think largely as it relates to vets is a lot of the research is survey based and things of such, which either directly or indirectly kind of hints at some of these things, at quality of life. But it's our job to figure out also why as you mentioned, why, and if quality of life's improving, then hopefully that it's also having positive effects on their other, symptoms, or a reduction in medication use. But all of that needs to be done, obviously, under the guidance of a physician who understands that, the complexities of treating vets with PTSD.
Well said, but the quality of life, and in turn with relationships, and the quality of life, not only with their personal, but the quality of life with their family members, et cetera, it has been very beneficial. And so, Jordan, closing remarks here.
Well, I think, you brought up another point. We're just at the end of the discussion, right? Which is that, everybody is a patient in the context of their universe, right? Which means that not only are they affected, but their children, spouses, parents, other relationships, whatever it may be, are affected. And there is that kind of ripple effect, as you had been mentioning. And I think so addressing PTSD is hugely important, and cannabinoids really do provide us with an important new tool, or relatively new tool. But again, like all medicines, where there's benefit, there's also risk. You can't have one without the other. There's no free lunch. And so we need to, the veterans deserve the kind of care that we're talking about, where they're not being sent to their buddy, or they're not being sent to the street. They're getting real, educated, data-driven care by physicians and other clinicians who have taken the time to become conversant with this medicine, just like we might be take time to learn about antipsychotic medications for another set of issues. So yes, I think that this is what people need. ACS, Association of Cannabinoid Specialists, is here to provide that kind of balanced, human evidence-driven education for clinicians. And so we would welcome people to follow up with us, and they can find us online at www.cannaspecialist.org. And unfortunately, for the moment, you really do need to put in the W's, because otherwise you get this SSL error, and we're working on that. But anyway, again, www.cannaspecialists.org. Thanks.
Perfect. And so if you're a vet, if your loved one's a vet, please reach out to us, or other medical professionals who are here to help. So I'm your host, John Malanca, with the Association of Cannabinoid Specialists, Dr. Adam Abodeely, as well as our founder, Dr. Jordan Tishler. We thank you, and we'll see you at our next episode of Casual Conversations. Good night.